There we go. So we got our recording on. Welcome to our virtual coffee here. Hopefully you can hear me loud and clear. I know a few of you were missing my music tones this morning, but anyhow, let's get started. Without further ado, we've got quite a bit to cover today. For those of you that are brand new or fairly new, welcome. I know every week we are getting new agents joining us, and I'm really happy to be a place that you guys hopefully want to be at and want to come to. And obviously, each Friday, this is our communication, our team meeting, as we like to call it. We call it virtual coffee, and we're here for up to an hour every Friday. It's also recorded and put on our portal. So if you look out later today, you'll have today's and last week's on there, so you can catch up with some of the key news. Don't forget, we have our chat box here. That's for you guys to chat between yourselves, ask questions, help each other support. I know Richard Manning there quite often is the catalyst and helps you guys with that kind of connection, etc. So that's some good collaboration on the chat. We also have the Q&A. That's for you guys to ask specific questions to our panelists. And just to let you know, we have on there today myself. Also, we have Lisa Perry, who is our operations manager there. She runs all of our contracting and really everything from start to finish, keeping me in check. And we also have Diane Leslie as well, Richard Manning, and of course, our weekly guest, Judy Daniels, and she'll be doing her corner a bit later on. Okay, so let's get started. A number of things to cover today. And of course, a lot of that is what comes up during the week, what things and questions I am asked, and also some of those updates that are happening in our industry. So let's have a look at some of the AMA updates. Just really talking about OEP. We're already halfway through January. OEP traditionally has been growing every single year. Some of you that have been around a long time would recall OEP used to be called the disenrollment period. So it's all about folks that wanted to disenroll from the plans. They obviously changed that a number of years ago, and now is the Medicare Advantage open enrollment period. So specifically, this is for Medicare Advantage, right? So you have to be in a Medicare Advantage plan as of January the 1st to take advantage of this. And I know Judy covered some of those enrollment periods as well. So what's your plan? You know, there's certain rules and things that we can and can't do during OEP, and it's important that we obviously adhere to those, but also it's an important time for you to go and help folks that may have been put on the wrong plan, or for example, they may be your clients and they didn't really understand the plan fully they're going on. So this is a kind of one-off opportunity. I call it a safety net. It's their safety net for our clients to help them make an additional switch there. But also it gives us an opportunity as agents to really help those folks that may be on the wrong plan, and also help you grow your business as well. So if there's Medicare eligibles out there that you're talking to, you're not allowed to promote OEP, but of course what you can do, you can make sure you talk about, look, you know, there are many times in the year when you can enroll in plans. And of course, they'll ask the question, well, I thought the annual enrollment period had finished. Then you can go in and say, there's actually an enrollment period called OEP, et cetera. So getting in front of your clients at kiosk meetings or community events, even our Medicare resource centers as well, getting your marketing out there. You can't market OEP, but you can absolutely market that you offer a full suite of Medicare Advantage plans and you're here to help. So last night I was talking to a couple of agents that are continuing their success in their kiosks. And these are things like CVS kiosks, Walgreens, those type of things. And the fact they're just getting in front of clients is making a big difference to their book of business as well. Okay, AEP commissions. A lot of these have started to come in. We've probably seen about half the carriers on our Blue Shield paid over the last week for those of you that are with Blue Shield. And of course, they pay their renewals at the same time as well. So you should have saw those this week. And now we've got some of the other carriers starting to come in. For example, Wellcare came in this week as well. And then we're waiting on folks like Alignment, Brand New Day, etc., to kind of complete that list. Humana as well came in this week. And of course, if you're waiting for overrides and are an agency, then for sure they're going to be coming to you as soon as we've received them at the end of this month. The other part of this as well, making sure you've been paid correctly. I've had a lot of folks saying, look, I enrolled this many people, I wasn't paid correctly, what do I do? Well, your job is really to double check that. Part of your role as an agent, part of your role as a business owner, being independent, is to make sure you are getting paid correctly. The last thing you want to do is put all that hard work in and you know, not get paid correctly, and it does happen. I was talking to one of our carrier partners last night about compensation, and it came up around, you know, even that they were or have incorrectly paid. So make sure you're using something like a CRM, easy to use. You may be able to upload your statements and then you can get a report that says what you are being paid correctly on and what you are not being paid correctly on. If you don't have a CRM, don't know how to use one, then just use something as simple as an Excel document and then match your commissions. And you can simply, on an Excel document, put an additional column saying by each month what you paid, and then you can go and check that. So something as simple as that can be used as well, but just please make sure you do that. Okay, as you know, AEP is well and truly in the rear view mirror. And, you know, I don't know about you guys, but this year it felt a tough AEP, lots going on. And now trying to get into 2024 and really plan for the year has been a tough few weeks. So I hear you, I feel you out there, and we're going through the same here. So to celebrate particularly those of you that were our top performers for AEP in 2024 enrollments, we're going to be out and about, or specifically I'm going to be out and about over the next few weeks to celebrate our top agents. It was great this year to see over half of our agents who were our top producers this year were all new, all different. And that was really good to see. So it's not the same people year after year. And that was super exciting. And I'm just going to show you a little photo here. So last night, I was invited to celebrate with Miss Terry Urick and her agency there in San Diego. So hopefully you can see this. This was just a couple of photos that was taken. We had a lovely dinner here at a Korean barbecue joint, and we were able to celebrate some of Terry's top performers. And we even had a representative there from Scan Health Plan, one of the major carriers that we work with in San Diego, with us as well. So just a couple of photos. And it was great to be invited to that event. So I really appreciated and enjoyed our time yesterday. Okay, let's go back to our document, which I know you can't see. So let's start again here. My apologies. Technology works great sometimes, right? Okey doke, where are we? A few technical issues here. I thought that was going to be easy just to share that screen. Oh, here we go. It's loading back up again. There we go. We're going to get back started. My apologies here. I thought I was... There we go. You can see that now. Fantastic. So let's start our slideshow and then we'll continue. And we're going to have to reshare here. There we go. We're back. So yeah, where were we? Yeah, of course, we're going to be out and about celebrating our top agents. So I will be in communication with some of you over the next couple of weeks, just to make sure we can get that in the calendars And realistically, that's going to be over the next 5 or 6 weeks. But I look forward to meeting and seeing all of our top producing agents. Also, we're going to be doing some training in February in person and on Zoom. Also, Judy Daniels is going to be out and about doing some dual eligible training. She's going to talk more about this on her Judy's Corner. So I don't want to steal your thunder, Judy, but we're really excited about that coming up as well. A few more updates here, kiosks. So I did mention earlier, just really the fact if you are working a kiosk, it really does give you an opportunity to talk to Medicare eligibles. It gives you an opportunity to talk to seniors. So please reach out if you are interested. Of course, we got a number of Walmart stores that some of you as individuals, or you're working with another agent, or even another integrity business unit. It's really important if you're interested in staffing one of these Walmart stores, please call me or your GA or one of our administrative team. And please do not call Integrity or Berwick directly to get appointed, contracted with a Walmart program. There is a set process in place. And because it's new, we are really finding our feet on this. So please don't reach out directly. Okay, we still also have a ton of other opportunities. For example, even this morning, I got an email from Select Health about 2 other Smiths locations, one in Henderson, and then I think one on the west side there as well. So we do have some shifts and availability. Smiths, as you know, is a Kroger store. And of course, Select Health have a specific Smiths grocery plan where you can get $60 a month towards your groceries on that brand new plan. So great opportunity for any agents in Las Vegas for the Smith store. Obviously, if you're not contracted with Select Health, please reach out to Lisa and she can get you those connected straight away. This week, I've had a ton of questions about the CMS proposed final rules. And I'm going to run through that with you guys just in a moment quickly there before Judy's Corner. Carrier trainings, lots of in-person trainings starting up. I've got a list of a lot of them on our little carrier updates today. Don't forget, the more training you can get, the more you can get in front of carriers, the more opportunities you will get. A lot of our carriers want to work with you. They want you to be their cheerleaders. They rely on us to go and sell their products. So they're going to do everything they can to help us do that. Another really major topic this week I've had is enrollment periods. I know Judy covered a big session on enrollment periods, last week, a couple of weeks ago now, I think. But I've had a number of you reaching out to me, asking me what enrollment period to use, particularly if somebody has a plan that's leaving the county or a doctor that's no longer taking their plan. I've had a few people say that they've put, or use the enrollment period and it's actually come back denied. So making sure you use the right or correct enrollment period is critical for your clients, and again, you don't want to be putting that wrong enrollment period. Please reach out if you have any questions on this. I know Judy as well is particularly an expert in this field. She can help you. Sometimes all it does is take a text. And again, even yesterday afternoon, when I was on my way to a couple of meetings, I was getting texts about this very thing. And again, sometimes we can just answer and put, your mind at rest, or, you just want to bounce ideas off us. And of course, that's what we're here to do. Okay, so I want to briefly talk about the CMS proposed, and I say proposed final rule, and this is kind of my take on it. So a few weeks ago, we went through a number of slides on the CMS proposed final rules. This comes out every year, and if you remember last year's proposed final rules went into effect as of October the 1st. And that included some changes in things like call recording, the 48-hour scope of appointment, lots of marketing changes. Well, this year, again, there was another 565-page document. Sure, you probably haven't read every page. I've gone through pretty much everything on there. And in particular, the theme that's really going to affect us, and I suppose the elephant in the room is what's going to happen. What's going to happen to you guys as agents? what's going to happen to agencies like myself, FMOs, NMOs? We don't really know, but I've just color coded this to make it easier for you guys to read. So maybe, and again, this is the wording specifically taken from the CMS website. So this is exactly what CMS is saying. And I don't want to read out the whole thing, but I'm going to give a couple of points and then some things that I've heard this week, speaking to United Healthcare. For example, I've got their take on it this week, but also my own personal thoughts on this and talking to a couple of other carriers. So first of all, the statute that states, the marketing standards and guidelines to ensure the use of compensation creates incentives for agents and brokers to enroll folks in Medicare Advantage plans that's intended to meet their best healthcare needs. Well, what CMS is basically saying is they believe that due to financial incentives to agents and brokers, FMOs, GAs, you name it, some large carrier plans have offered additional incentives, and it's resulted in beneficiaries getting or steered onto Medicare Advantage plans that may be not best for their needs. I don't necessarily agree with that at all. One example is one of our real close carrier partners, Scan Health Plan, were offering marketing dollars if you sold over 10 or over, I think it was 4 enrollments or applications in a particular state or city. That's the type of thing that this is trying to stop. And I truly believe that that's what CMS wants to focus on. So they are proposing, and this is a proposal, to redefine compensation to set a clear fixed amount that agents and brokers can be paid regardless of the plan they enroll in. Well, that happens now. As you know, we get paid exactly the same no matter what plan the beneficiary enrolls in. However, the proposal has some specifics here. So I'm just going to let you know the proposed national rate is going to be a fixed amount of $642. That's an increase on what we're getting now. So if you look at that, the proposed fixed amount is about $31 more than the current 611. That's basically what it is at the moment. 611, that's the national. They want to put it to 642. If you live in California or Connecticut and you get more, obviously that's going to remain similar, I would imagine. But they're just looking at the national average. So that what they're going to do is say, right, we're going to give agents this amount, but that's going to include everything. And that's going to eliminate all of the variability. This includes HRA payments, VBE, HA, no matter what. I don't believe that's something they should do because that's an additional job to what you guys are doing. You're getting paid to enroll folks and put them on the right plan. And then obviously on your renewals, you're getting paid to look after that client, make sure they have their questions answered, et cetera, et cetera. So what this is set to do is the proposal is stating that agents are going to be paid that amount. The other part in bold is the proposed rule is going to prohibit contract terms between Medicare Advantage and marketing middlemen such as FMOs. That's what field marketing organizations. So you think about that. That is saying it's going to generally prohibit contracts between Medicare Advantage organizations like United Healthcare. So it's saying they're not going to have contracts between FMOs. That would result in things as volume-based bonuses for enrollment. So purely CMS are thinking that FMOs, et cetera, are pushing agents into selling one plan. That's what they're saying here. To be honest, and they're also using the word interfere with the ability of agents and brokers to assist the enrollee. Well, absolutely not true. So this is what CMS is putting out there at the moment. In fact, this week I had a meeting with United Healthcare and was speaking to one of their VPs. And I asked them, I said, so what's United Healthcare's stance on the new CMS proposals, in particular, the part about agent compensation? Funny enough, they just had a meeting with their senior leadership team and their governance team. So the folks that are in there in Washington, et cetera, and the folks that really focus on some of the legislator and bills that come out with healthcare. And as you know, United Healthcare is the largest Medicare Advantage company, Medicare supplement company, largest healthcare company pretty much here in the United States. So I asked the question, and what was really pleasing was their stance was United Healthcare wholeheartedly supports their agents, their brokers, and their agency partners, including FMOs, GAs, MGAs, whatever you may be. So United Healthcare wholeheartedly sees the value, knows what we do, and they do not want to have a major change to probably the most successful part of our healthcare industry we have, which is Medicare. So I know for a fact that United Healthcare have written a letter to CMS. Also, I happen to know that the head of compliance for United Healthcare is on this CMS working group that includes the director of CMS. And obviously, clearly being the largest carrier, I'm sure it has some influence in that as well. So the fact that they believe that and they really want to keep generally things as they are, yes, they probably say, look, stuff could be improved. We could tighten up some things. But I think the key part is they want to make sure that agencies and agents are compensated for doing their job, which is my job is to help support, provide you opportunities, and really help you be successful by making sure you enroll your beneficiaries on the correct plan. That's my role. So, that was really pleasing for me and it was really encouraging. The other thing that came out from that meeting was I was told that we are expecting to hear about what that proposals mean, or as in the final rule, in Q1. So we're actually going to be expecting to hear what this means for all of us by the end of March. And that's about 2 months earlier than we would normally find out. So what are my thoughts? What do I think? A lot of people have asked me what I think on this. A couple of things. As I mentioned, Medicare is our country's greatest success of offering affordable healthcare, right? No doubt about it. It's successful. Yes, it can be costly. Generally speaking, I believe that when the government runs it, it doesn't run as well when folks like our carrier partners run their different plans and run the healthcare. So I truly believe that having Medicare Advantage is critical because it allows the folks that know how to do this properly. They're more efficient and more successful. I cannot see that we are going to have such a big change in an election year, 3 or 4 months before an election. We are going to totally change Medicare because this is what this would do. This would change Medicare. This would change how many agents are going to stay selling Medicare. This would change the fact there would be no agencies around, and it would completely change really the experience our beneficiaries, our members get, because purely it would mean there's less folks looking after our beneficiaries. And the other thing is CMS hears about the all the negative stuff. They hear about, oh, the complaints, this person said this, I was put on the wrong plan, I didn't do this, but they don't hear about those stories. And all of you on this call, I'm sure, have many of these stories. You might have helped a senior, maybe they're in their 70s, maybe 80s. They don't have access to technology. They don't have access to a smartphone. Maybe they speak a second language and English is not their first language. And you know what? They don't know what is available out there. And I've had instances where I've helped folks save thousands of dollars on their medications. I've helped folks, and I'm sure you have the same, where you've helped them get access to things like dental that they weren't able to afford, or maybe a grocery card, a gas card. Even now, some of the carriers are paying folks rent. And these things not everybody knows about. And I've had instances where my clients have been in tears and like, Neil, I'm so happy. I don't know what I would have done without you. But CMS doesn't hear this. CMS doesn't hear any of these amazing stories and the fact we are needed in our communities. And I truly believe that. So that's my thoughts. I believe there's a lot of folks that are wanting to keep things similar to what they are. I think there are going to be a few changes. I think they're going to limit some compensation, and particularly, where you get offered a marketing co-op additional payment if you sell so many enrollments, that's going to not be allowed for sure. But generally, I believe that I think we're going to keep things similar to what they are, but we're going to see more defined rules around what we can and can't do. The good thing is, once we know that, we can just go about our day. And that's what I wanted to talk about today around the proposed final rules, particularly with compensation to agents and brokers. And again, it's supposed to stop anti-competitive steering. But actually, what this is going to do, this is going to hurt our beneficiaries. It's going to hurt our seniors, and nobody wants to see that. Anyhow, those of you that know a lot about what's going on, I apologize. I've had so many questions this week. I did want to cover it. So before we go into Judy's corner here, I am just going to look if we have any questions. Let's have a look. Eliminating renewals question. I don't think so. I don't think they're going to eliminate renewals. That wasn't mentioned. I think more than likely it's going to be those additional payments. They want to stop things like the HRA payments. However, that's not, we're not being paid for that. When we do an enrollment, it's not part of that. So I believe we should be compensated, because those HRA payments do help increase star ratings. They do help our health plans gain access to understanding our clients more. It's an important part. And even that, I brought it up with United Healthcare this week, and they were like, look, we used to do this on our own. We used to reach out to clients, beneficiaries, and guess what? We got no response. We got less than 2% of folks responding. So once agents were able to do this at the time of enrollment, that's increased by 40 to 60%. It's a huge increase. So, there's reasons that we do this. And I believe we should get paid. But that's the type of thing I think they're trying to eliminate, not renewals. Okay, I'm going to put myself on mute now, and I'm going to invite Judy to go through some stuff. I'm going to make you the host, Judy, if I may. And that means
please do
share your screen. So thanks for coming on the call. Anything you wanted to add on the final rule? I just wanted to cover it again today. That's, just from some of the questions I've had this week. I didn't know if you had any other comments to make.
I think that you did a great job in sharing your thoughts and making sure that your agents knew that they have a partner that is being an advocate for them when you're meeting with the different carriers. And the carriers are good partners as well. And as you said, United Healthcare does have their compliance officer on that board that meets with CMS and or that is part of CMS. And I do think that it's important for you not to freak out as an agent, but just know that everybody is really behind the agent and the agencies and the FMOs in how we are able to help the public and helping them to find a plan that would be best for them. Yes, I think things have gotten screwed up over the years by a lack of uh, inspecting what they expect with some of the rogue agents and agencies that are out there. But going about it the wrong way is not the answer. Going about, trying to fix things the wrong way is not the answer. So, thank you, Neil. That you said it well. The only thing that I will say is stay tuned. We have a couple of months before the final rule that's been proposed becomes the actual final rule. And I really do have the confidence that the right things will come out and happen. And I want to thank all of you that are on this call this morning for continuing to be ethical, very professional, and very knowledgeable agents out there. So without further ado, I'm just going to get you up to date on some things. And as Neil said earlier, yes, we have duals training coming up, and partnering with AMA is always a thrill for me because I get to see you guys whenever I come out to one of these. And Neil asked me if I would do specific trainings for AMA agents, and of course I said yes. So first of all, on February the 7th, we're going to have Berwick Boot Camp. And on the sales side, and I'm going to be presenting this. It'll be a webinar, of course, at 9 a.m. on February the 7th, and you can register for that in the Berwick Agent Portal. Now, keep in mind, this is going to be duals training for all of our Berwick agents nationally. So I'm not going to be able to get really thick into the weeds like I do when I'm doing a specific training in, let's say, Nevada or California, because Medicaid in California, for example, is Medi-Cal. In Nevada, the Medicaid program is a little bit different than it may be in other places. And not vastly different, but a little bit different in some of the rules that may have come down from that particular state. So, webinar on February 7th. I encourage you to be on that to get some good basic duals training. But then I'm going to be coming out there live in the following areas. Locations are still being determined because I've got a special announcement here. We're going to have a carrier partner at each of these live trainings who, after my presentation, will then do a presentation about their specific dual special needs plan. And you'll get a lot of information from the carrier that way. And you'll also have a meet and greet opportunity that's going to be available for you immediately after. So I encourage you to come out to a live training. It's always exciting, and I think you always get maybe a little bit more from being there live because you can ask questions live and get those immediate answers live. And we're working to get a simultaneous Zoom presentation done at the same time, where if you can't make it live for whatever reason, you'll still be able to view that. And I know that Neil is very good at recording these things, so we'll make sure to get that recorded as well. Now, February 15th is going to be in Northern California, and that's going to be in San Jose, and it will be live. Again, the location is going to be determined. I'll have that nailed down today. February 21st is going to be in Las Vegas. And again, live, location to be determined. February 27th in Los Angeles. We're going to do 2 locations in Los Angeles that day. So keep your eyes out for that. February 28th in Riverside County, actually in the city of Riverside. That location is to be determined. And then February 29th, wrapping things up in San Diego. And I know that Terry and her team are the main players down there, of course. And so we're going to be very excited to see you guys down there live. And again, because we're going to be having that carrier partner there as well, it gives you an opportunity to really dive deep into a product and how it can really help your clients who are duals, who have Medicare and Medicaid, Medicare and Medi-Cal. I will tell you that the one in Las Vegas is going to have Anthem as our carrier partner that's going to present their dual special needs plan and how valuable that can be for your clients looking for those extras that may be important for them. And then, of course, we're going to have a meet and greet event right after. So definitely save the date in your calendars, you guys, and we'll get those times and the locations out to you ASAP. Next thing I want to talk about, sorry about that, is again, checking your commissions. And Neil had alluded to this earlier in his presentation this morning. I just want to make sure that you do take the time to look at these things because you earned that money, and you want to make sure that you are getting paid. And mistakes can happen. So the first thing you want to do is pull your enrollments by carrier, whether you have paper applications in files or whether you have electronically done applications and you have that application list from your carrier website. You want to pull that and make sure that you've got that set aside by carrier. The next thing you want to do is access your commission statements for each carrier and then print them out so that it's easy for you to check them off as you find each enrollment on that commission statement. As you check off each client name on the commission statement, make sure that you're looking to see that you have been paid correctly. And then lastly, if any are missing, take action. once upon a time, when I was with United Healthcare, I had an agent who contacted me and said, "Hey, I have enrollments missing." And I asked her to call her FMO, her upline. And I won't say who that agency was. They're not under Berwick, but that agency owner said, I don't bother to check commission statements because it's not worth my time. And she simply said, it may not be worth your time, but it's money to me. And evidently he felt that it wasn't worth his time and money to go in and check on these things. The great news is, you guys, if you're under Berwick, you have our wonderful agent support team to help you and to take the onus off of you as far as, going and contacting the carrier with those missing ones. So make a list by carrier on a spreadsheet. And we do have a spreadsheet that you can use for reconciliation. You'll be notating the member name, their Medicare number, and the date of the application. And then you're going to send it to Berwick's agent support team at agentsupport@berwickinsurance.com. You'll want a carbon copy or CC Lisa at coveredama.com and Judy at berwickinsurance.com. Between the three of us, agent support, Lisa and me, we do want to make sure that you get paid your commissions. We'll take the onus off of you of having to actually follow up with the carrier. We are going to send that spreadsheet in and we can make sure that you get the answers that you need. But please don't get upset. If you find that you may be missing commissions from a carrier, a couple of commissions, 3 or 4, 4 or 5, whatever it is, just keep in mind mistakes do happen and clients disenroll without telling you. You might have missed an email that the carrier sent asking for additional information because maybe something was missing on the application. And if you didn't see that email, you didn't send them that information, they may not have processed the application. There's a lot of different things that can happen. I even was in Fresno yesterday and found out that a couple of this agent's clients didn't receive their cards. And he went into the system, and lo and behold, where he'd gone into scans cubed to process this paper application in there, it was showing that the application was in process still on that screen. Now, these were from back in November. And it turns out that his office associate who inputs those things into the scan cube for him did not press that submit button at the end. So since then, it had timed out. Thankfully, these are Medi-Medis, and so they're able to enroll them this month for a February 1st effective date. But something as simple as that can happen. And obviously, if he had already been compensated by scan, he probably would have been checking his commission statements and found that those were missing. So it's important to look at those things, take a deep breath, just start the process as these statements start coming in and as you start getting your checks. Keep in mind that Blue Shield of California, if you sell Blue Shield of California, they always send their renewals as a lump sum. They don't send it out 1/12 each month of the following year. So you will have two big checks from Blue Shield of California. You'll have one for your AEP enrollments, and then you'll have one for your renewals. And a lot of agents call that their shiny object money, maybe as a down payment for a new car or for a nice vacation or something like that. And but all the other carriers are going to send out your renewals as 1/12, so that you get that each month. But the new enrollments that you did for the annual enrollment period for 1/1 effective date, obviously those are going to be paid in that full commission status at that point. Do we have any questions out there, Neil? Let's see. I think let's see, do you have any idea how long the in-person sessions will be, half day or full day? Well, great question, Scott. In general, I'm going to make the presentation itself about an hour and a half. And then we're going to have about half an hour for the carrier to explain the benefits of that dual special needs plan in full. And then, of course, we're going to have the meet and greet afterwards. So maybe set aside 3 hours at the most. Okay. Another question, will the carrier at the live events be one who is predominantly operating in that particular area? Yes, Ingrid, it will be. I have selected these carriers, carrier partners based on that being the predominantly operating carrier for DSNP in that area. Um, let's see. Scott is asking Lisa for a copy of the commission tracking spreadsheet. Yes, she can send that out if you would email her, please, lisa@coveredama.com. That is the best way to request the commission tracking spreadsheet. Another question, is there any date when compensation for us may change, or is everything still in the air? I think you're referring to the proposed final rule. And again, we'll know that in the next few months. And is the training going to be most likely in the morning? Well, there may be some morning trainings and there may be some afternoon trainings. I know that in Las Vegas, where you're from, James Smith, it is going to be an afternoon because we want to have a little bit of a happy hour afterwards. Okay. And I think that answered all of those questions, Neil.
Yep, I think so. One final one that came up, will the carrier at the live events be one who is predominantly operating in that area?
Yep,
Absolutely. Yes, that's the reason for it as well. And the trainings are probably not going to be at the Medicare Resource Center, particularly if we're doing a lunch or a happy hour afterwards. It's more likely to be either a hotel or restaurant location where they serve food and beverage.
that is correct. I'm going to be the
Okay.
hostess with the mostest this year.
Absolutely. I'm looking forward to those events. And of course, I will be in attendance at all of the in-person events as well, coming up in February. Judy, thank you for your time this morning. Anything else you wanted to add?
I think that's it. Again, as Neil said, it seems like it's just been a slow start to the year. It's almost like you feel after a hangover, right? But but I think we all were so focused on all of these disruptions that were happening and trying to help so many people, and we're still in that mode because there was a lot of disruptions where plans terminated, and we are still trying to help the folks out there. So just take a little bit of a breather, whether it's a weekend or a week of vacation or something, but at least try to take a couple of days where you can just relax and maybe watch some football or take a walk on the beach or spend some time with your loved one, but relax a little bit and then start back at it again. You got to watch out for your own mental health as well.
Absolutely. This year seems to have been one of those years. And as Judy said, take a bit of time and, give back to yourself. Okay, well, let's get this show on the road for the last 15 minutes or so of the call. And we got our updates, our usual updates. I've noticed this week a lot of really great tools that are coming out from our carriers. And funny enough, I missed a few this week until I went back and read through on all my emails. And that's what I do on a Wednesday or a Thursday. What I do is read back through all my emails that I have, particularly from our carrier partners, medical group partners, and from you guys as well. And that's how we put together our virtual coffee. So let's have a look. First of all, in Nevada, Intermountain voted best doctor in Pahrump Awards, and they got an open house. Actually, that happened, I think, last week. So just wanted to mention that. Medicarians. So this is the time of the year where a lot of Medicare conferences, a lot of events throughout the country. And I get asked all the time, which one should I go to? And particularly in Las Vegas, it seems to be the haven for conferences, right? It's a great place to be, fairly inexpensive for folks that are putting on the conferences. And, I've managed to go to a number of them over the last couple of years. So the Medicarians essentially is what I would call a high-level conference. It gives you a lot of high top-level information. Yes, there are booths and carrier partners there, but also a lot of technology vendors, a lot of folks that are new to the Medicare space. And Medicarians, last year they did an agent symposium on day one, because at the Medicarians, you not only have agents, but predominantly you have FMO, carrier partners, And we're talking senior folks, we're talking C-level carrier partners, so C-suite level carrier partners are there on the stage doing doing the roundtables or doing the presentations. But Medicarians made it more open last year for agents, and they did an agent symposium on day one where it's really focused towards agents. This year, they're going to do the same. And again, it's at the Fontainebleau, the brand new hotel they started building in 2008 and eventually finished because they went bankrupt, etc., about a month ago. So it's April the 8th to the 10th. They have an all-access pass. The ticket's around $1,100. So you're thinking, geez, there's no way I'm going. However, you can apply for a hosted ticket. And a hosted ticket means this. A hosted ticket means you can get that ticket for zero cost. Yes, zero cost, and you're hosted. So essentially, the sponsors are hosting you, and you have to agree to 3 meetings. And what I mean by meetings, they have a meeting area, a big, huge area with little chairs and couches where you can actually go online on the app and agree to meet with some of these partners. So I'll give you an example. We use a lot of marketing companies to support us, particularly for our dinner and educational meetings. For example, Leading Response, they're there. Some of the other marketing companies there as well. There's a big section for NMOs, so integrity there as well, and a lot of other folks. So technology companies seem to be the key thing last year, and they spoke a lot about artificial intelligence. So I would imagine there'll be a lot of companies that are going to offer a number of products and services to agents, and that's what they want to do. They want to meet with you. So if you are interested in a hosted ticket and you'd like to come to the Medicarians event, I will be going. I've already got my ticket. We'll be happy to spend some time with you, meet with you. They actually have a kind of meeting place. They call it the meeting place, where you can meet folks, have meetings, etc. Very successful. So if you are interested, I can actually help you get those hosted tickets. I know if you go on to LinkedIn, there's a number of folks that say, hey, you can get an exclusive hosted ticket through me. Well, the reality is you can get that hosted ticket. I'm just going to show you how to apply for that. So please reach out to me. Don't do it in the chat or the Q&A, because once we leave this meeting, I will not see it. Please text or email and I'll send you that information. Okay. Select Health, as I mentioned before, they've got a brand new product this year, which includes our Smith stores out there in Las Vegas. So those folks that are in that area, please note they've got their brand new MasterCard as well, which also acts through Nations benefits for their OTC health grocery wallet as well, can be used. That's just a list of the benefits and what they can utilize that for as well. Select Health have their brand new dental directory as well. So again, this is electronic, available for you to download. It has all of the dental processes, what are the copays, how much it costs, and all of the providers listed in one place. They've also got the Intermountain Home Delivery Pharmacy, which again is a downloadable and clickable document. Tells folks how they can save money on their medications and pharmacy costs, as well as how to access that as well. United Healthcare are doing a Nevada OEP-SEP rollout. This is going to be virtual on February the 1st, so please put that in your calendars. Zoom meeting there, and again, you should have seen this. If you haven't, I can get it sent out to you, where you can click to register. February the 1st. WellCare, as ever, doing a ton of different trainings. They do offer a lot of trainings. As you can see, towards the end of January and into February, they've got their weekly Let's Talk Leads, telephone techniques for selling, lots of really interesting sales and opportunity trainings, as I would call it. So I'm really excited about some of the stuff they're offering, including the American Legion Partnership Review. They're going to talk about their partnership, how agents can get involved as well. The other thing is as well, I know with WellCare, they are one of the carriers that offer regular opportunities to join call blitzes and get leads. So I'm really excited about some of the stuff our team at WellCare are doing over the next quarter. Let's look at California then. So if you look at Aetna, the Aetna Medicare Advantage and dual special needs members, really talking about that healthy home visit. I think we spoke about that last week. Again, there is a participation requirement where folks can have people come out to their homes to help them for their home health care. And again, lots of information about what happens after the appointment, how long will the visit take, how does the member prepare, that type of thing as well. You should have received this in your email over the last week. Okay, Anthem are offering some helpful Medicare 101 webinars. And again, Anthem is offering webinars to our current members. So those folks that you have that are approaching Medicare eligibility, Anthem are going to host these webinars. So it means you don't have to. They're all through Zoom. And again, there's for both those individual and small group folks. So if you have a book of business, small group or individual, and you have a list of folks that are turning 65, Anthem will actually do that Medicare 101 for you as well. You'll get an invite you can send to your clients and they can register for that session. What it does mean as well, they're not going to get any outreach from any of their internal sales team. So this is purely as a offering to support our agents and agencies. And again, it just talks about a Medicare 101 for brokers, and that is happening on Monday coming up. So any questions, please reach out to Victoria. Okay, Medicare supplement bonus for Anthem has been extended through July the 1st, 2024. So again, you can earn an extra $200 a sale for an open enrollment bonus. Open enrollment is when somebody's new to Medicare. That's just the wording used for supplement. And if it's an underwritten plan, then you can get $150, $100 in year one, $50 in year two. Again, as I mentioned here, some of these new guides that the carriers are bringing out, really good. Anthem have a getting started guide as well. And again, this is around your clients. There's a getting started guide for your clients with Anthem. So if you have Anthem members, you can actually look like a hero, get them set up with everything they need to get started with their plan. And again, the carriers are starting to provide these extra tools and benefits. If you're in Northern California, next week, Tony, as many of you know him by, is doing a training. And again, this is going to be learning about that EAE DSNP 2024 plan, some stuff around the durable medical equipment for dual eligibles as well. I think there's going to be a guest there, from Shield Healthcare as well. So next week, RSVP is needed, but again, learn all about duals, etc. next week in Northern California. I mentioned as well about supporting clients and prospects, OEP. Don't forget about the rules around OEP. I'm not really going to go through this slide because I mentioned it earlier. Make sure you understand what you can and can't do in OEP. And in fact, we got a couple of carriers actually been sending stuff out talking about that as well. The other thing I wanted to mention was the Anthem's full dual align DSNP. So what is the dual align plan? As once you've looked on the plan, Anthem has a couple of DSNP plans. One of them is the align plan. And I know when we do the Northern California section, we're going to talk about this in a bit more detail. So what is an align plan? This is for duals that have both Anthem DSNP, but also they have Anthem for their Medi-Cal as well. Don't forget, in certain counties, it's now mandatory in California for those folks that are on or dual eligible to have a managed care plan for their Medi-Cal only. As we used to say, we used to talk a lot about fee-for-service Medi-Cal. Well, that's when they just have straight Medi-Cal. Well, in some counties, you have to have what is known as a managed care plan. So your Medi-Cal is then aligned. So what Anthem and a lot of the carriers are trying to do is align that plan. So they have a Medi-Cal plan through Anthem, and they're going to have their DSNP through Anthem. If that's the case, they should be on this full dual align plan. Why would a client want to have the D-SNP? Well, the bonus, it features 4,000 of dental allowance. That's just one of the key things that when you're out there talking to these folks that are dual eligible, you should absolutely be saying to them, look, you know, you have to be on a managed care plan now anyway. Have a dual special needs plan. You'll be able to get access to a dental allowance you wouldn't without it. And again, this is just some frequently asked questions. Don't want to go through all of this, but if you want to take a photo or just search in your box there, because you would have been sent this by Anthem already. So please, you know, these are the sort of things that some of you folks that don't lean into the dual, you know, are dual eligibles year round may not know about. And again, every county is different. This is the beauty about our industry. This is why, again, going back to that whole thing at the beginning, the whole CMS proposed regulations, it's a very complicated topic, especially when you talk around duals. So that's why we need folks like you out there, the experts of this industry as well. And again, it just asks those questions about, will I get the same benefits? You know, how does the coordination of the plan work as well? Blue Shield of California, as we know, they were kind of the last to come to the party, but they are offering $100 HRA on all DSNP enrollments. And again, they have their exclusively aligned enrollment. That's again, the Blue Shield Total Dual. So that's again, when that plan is aligned with Medi-Cal. So you're getting to really understand those managed care Medi-Cal plans and of course the D-SNP plans. So you can earn that $100 for the HRA. Also, the commission schedule for 2024 has been updated for Medicare products applying to new health plan contracts with effective January 1st, 2024. There's a new broker agreement and payout calendar as well. Helping your clients again, you see, this is what we're getting a lot of, helping your clients in 2024. An improved online client list has been updated to show new capabilities. So you can download, print, and email your client's virtual ID card. Yes, a lot of our carriers are offering this now. I know about 3 years ago, we were like, oh, why can't we order? Why can't we download a copy of the ID card? Well, half of our carriers allow us to do this as well. You can also set up auto pay for your clients, particularly if they're on a Medicare supplement. And again, you can complete a one-time payment on behalf of your clients as well. Lots of great stuff that Blue Shield are adding to their online portal. Lots of trainings going on for Blue Shield as well. And this is throughout California, San Mateo, LA County as well. Again, coffee and chat with your local broker manager. I know Mary Yu Chang is kind of covering LA for most of us now since Tracy Aronell Jackson left the state. So again, she'll be covering LA County. Is an HRA and duals training as well. In fact, that is today at 2 p.m. So if you're at a loss this afternoon, then please join that training. Product training in the Bay Area, up there in Northern California, January 23rd. So again, that's next week. Inland Empire, Orange County, LA County, throughout the whole state. Again, I don't need to read all of this off, but you should have received this already if you're contracted with Blue Shield. If not, take a photo, reach out if you have any questions. And again, learning the MA Provider Network, Pacific Central Coast and Kern counties, specifically around their provider network. That would be really interesting because that's changed recently. And again, that's next week. LA County is next Wednesday. And then some supplement updates. So again, not forgetting you folks that sell Medicare supplement. You got Northern California on the 23rd and Southern California on the 29th. Brand New Day Central Health. You've probably seen some of their broker managers recently have announced they've got new jobs. What I mean by that is now they are working as a broker channel manager for Molina. Of course, that deal is pending to go through any time. So anyone under Brand New Day and Central Health is going to be joining the Molina family. Just wanted to talk about Brand New Day. They've been fairly quiet the last couple of weeks, probably because of that merger or buyout. So again, they got some training next week. Most of it is in virtual training at the moment. And again, this looks like this is in Northern California with our very own Sherry Hernandez. Molina, Talk of the Devil, they're up as well. So they have their DSNP eHRA, which is now available in iCaro. If you don't know, iCaro is their enrollment platform again. So that's available for you to utilize in their platform. What else do we have here? Enrollment opportunities, lots of enrollment opportunities, but again, making sure that as an agent, you understand what's allowed and what is not allowed. And again, all of those other enrollment opportunities, general enrollment period, IEP for those turning 65 and SEP. Okay, please join your Southern Medicare sales team, Southern California. Again, this is WellCare, lots of training from WellCare, similar to Las Vegas. Please take a photo here. Lots of in-person trainings there. Woodland Hills, for example, Torrance, and then back to Woodland Hills for a turn of LA County training. But also, if you're in other parts of the state, you can join those online trainings. Again, a new opportunity here through Carelon Health. If you didn't know, CareMore have changed their name to Carelon, and you might have missed that. I did go through it in AEP, but of course, pretty crazy for everybody. So Carelon Health is now in network with WellCare by HealthNet. So on some of those products there in LA, Orange, San Bernardino counties, effective January the 1st as well. And they have that opportunity to join the CareMore network or Carelon. Finally, we're at 10:01, so I've got to zoom through this. United Healthcare Medicare supplement plans. They have what they're calling a new Medicare puzzle on the toolkit. So again, you can get that straight away from the toolkit. Again, UHC, the biggest Medicare supplement carrier, the only one affiliated with the AARP. Why utilize Lean for your or 5 keys to success for selling. And again, Lean is just one of those as well. Wanted to bring that up to your attention. And again, what are the AARP benefits? This is a really good page because I get asked all the time, so why do I have to join AARP if I'm a Medicare supplement? Well, this is just some of those member benefits they get as well. So take a photo of this if you're on there, or again, reach out there. Alignment Health, CMS final rule, they're talking about the opt-out, and this is where clients have to have an opportunity to opt out once a year. So again, just to make sure we're following protocol here as well. And then Humana have got a load of new tools, and this is an onboarding made simple. This is for your members onboarding. Again, they're going to support you to build a sustainable book of business by helping with that onboarding as well. And you can see they've got a ton of events going on, then some stuff around their routine vision, and again, the downloadable onboarding tips and available in Spanish. They have a brand new RX calculator tool and their brand new update in New Mexico there. United Healthcare, again, these are trainings which are through Jarvis, Knowledge Center, training and certifications. So these are national trainings, always good to join. United has some great national trainers here. And as you can see, some dates for next week. And of course, strive for elite status this year. United Healthcare reduced the number of applications required to earn elite status through the authorized to offer Medicare plans program. Now just 25 applications per year. As an elite agent, you get access to marketing materials, the A2OH program as well, and lots of other good stuff there as well, where I think we are just about at the end of our call. I know we're 4 minutes over, folks, and I appreciate each and every one of you. Again, what I would say is just finally, the Medicarians event is a national conference. It just happens to be held in Nevada. And when will this webinar be available on the MRC site? I will make it available by tomorrow, Mr. Smith. Thank you, all of you, for joining us. Thanks for really getting engaged in the chat there. I'm going to let you guys go now. Appreciate your time every Friday. Take care.